Hi, my name is Abby James, and in this video I'm going to be demonstrating how to assist during an orchiectomy on a canine. And this is Oliver, and he is our little neuter dog. So all of our suture and surgical blade and the pack is already opened up.
So, in a neuter, I do pre-scrotal, and for the pre-scrotal, I will literally move the testicles forward out of the sac, and I'll leave the sac alone. It's a place that's got thin, reactive skin, and it does not do well with handling. So a lot of times I'll take the gauze and push it forward. And I try to find, so you got a midline right there, and that's where I want to set my testicles sitting on the midline. So when I do, I've pinched it, I've got that one pinched, and I make the incision on the midline. Now, my incisions go all the way down to when I start to see fat poke through, because that means you've gotten to the very bottom, or at least the most interior area of the scrotum. I'm going to ask you to grab one of these, which is your larger caramels. I use that to spread. So we'll do that on the other one too, and I'll show you this one. And I spread it. And that also gives a stretch to the skin. I let the testicle roll back, and I'll look for my blood supply and bring it up and forward. And then I pinch up and over, and I use my gauze to get the rest of the scrotal wall off of the testicle, because it's going to go back to its location, and I'll take and stretch things as I go around them. Then, taking a smaller one, because he's a little one, I'll go ahead and catch. And so I'll work only in this area, let that scrotum just lay there, and let the testicle, then undo what's, and then compensing suture, which basically means I'll put a throw to the back of the suture, so you gotta pull it under, and it throws behind me. So there's actually a twist to tighten from the back and the front both. So when you look, there's tighten gauge on the back that I won't look at because it's not my. And if you see how I'm pulling these, I'm trying to lay down onto him when I do it. So there's my 4 throws. Then I'll come back and do an anchor. I'll do another, and I may do up to 6 throws depending on how much tissue I've got gathered. I used to count in my head. Yeah, you count your head. Make sure you've got a minimum. 4 is the minimum. 6 is good. Alright, so I load it for my next round. I'll come and take one of the smaller clamps, use that, and I come back and I give myself a gap between, because there is, and these come over here, so they don't bleed on anything. And there I have my knot, my distance, and it's spread, so when it comes back together, it's actually got a width when I tightened it so it doesn't loosen, and I let it go. So you should have minimal bleeding. Here, and I'll set it back in there. Alright, so the next one, alright, same thing. I take my hand and I push that testicle forward. Okay, so I did it here. I'm going to use my blade one more time just to kind of work through there. So I do there goes this fat already, since I've already worked my way down in there. Okay, right, so grab the clean version of this caramel for me. There you go, you just hand it off. There you go. I'll come up underneath, spread it again, throw it over here since I used it. And I'm going to have you hand me one of the smaller ones to grip with as soon as I get my scrotal wall off. Alright, there you go. And I'll set this in. Same thing. Now, if you notice, you'll get sometimes a little bit of bleeding. There are good sized vessels, not huge, but vessels enough that you have to watch where you put things. And I'll send it underneath, I'll send it to the back. And I use my fingers a lot. I try not to use a whole lot of my needle holder edge unless I can secure it so it doesn't tear my suture material. And I've got my pinky pulling on this instead of trying to grab it with my hand. So I'm going to send this back to you while I cut. You can put that over there in its little pile. And I'll put you back to center there, young man. And I send this back. And the lay in that space where it came from just doesn't have a testicle attached to it. So the next thing in closing up, since you've closed where your vessels are, you're going to do a closure at the underneath, and then I do subcutaneous, then I do skin, and then we go ahead and do a surgical glue on top. And some dogs are persistent, they'll go and try to do everything. So when I grab this, I'm going to go ahead and try to close everything I see so that it's no gaps and no air pockets. And I have gracious plenty suture for him since he's a little guy. Now I give myself a little tail there because, and I will pull as I'm moving my fingers down the suture. I'm tugging on it, make sure nothing disengages or it loses a knot or two, that type of thing. Because it's got to stay secure for him. Now, this is also a different technique you'll learn. If you'll take this and tug up, don't ever try to grab down onto your suture. It will pull your suture up in position where it needs to tighten, but it won't endanger your suture from shredding because you're grabbing it. So I take this through, I'll take my needle holders and I'll pull up. So now this last one, I want to make sure I have a knot. I do continuous throughout, but I'm not in strategic places so that the line is secured. So even though it's continuous here in my hand, if anything should let go, it still has knots in place to keep it there. So now we're going to flip flop sides. And I always take my driving hand, being so overtly left, I flip over so I'm driving always on the same side. Now, this is a reverse cut, so it's a triangle, and so it has a cutting edge to it. So when I drive it through, I'll pick up and I'll come upward. I don't want to go downward and slice this way because then you'll just cut through your tissue. So as you drive it, this is something in his young skin, you want to make sure you actually get that skin edge to pull it over. Okay. And the more you oppose true skin edge, your intradermal, you're in the skin, the better it heals. Now I also stretch it if you see me throw my hand way out. I'm making sure, he's pretty thin around his skin, so I have to stay right on my line. I sometimes check the back because some of these guys, elderly and young, and that skin is not a thick surface. Right, so now I'm coming to this part, and to do a intradermal, but also burying my suture, I'm going to send my needle down so that it's not near my skin edge. It's actually taking it and it will bury my suture down as I come across to close the skin again. So if you see, I'm not in my skin anymore, I'm sub-cubed, and I'm going to make my knot there so it stays underneath that skin level. Okay, same thing, it's continuous, but now it has a knot that sits between, and I'll tug on it, make sure sure it's secured. And see, I'll pull this way so I expose where my skin is. Whoops. So that's drawing that skin up and over. And then I'm going to meet it on the other side. Get you a little bit more in there. There you go. And so if you want, see how that pulls through and it closes the skin over your knot. Now, sometimes you can get too close. Be a problem. And I'll roll my wrist back, so I'm always watching where that needle is. And then I'll bury the suture, the tip in. Okay. So now, I leave this attached until I have that surgical glue on top. But we're done at that point for them. I'll clean it out. Now, you got to count. I've got that one, so you need to go ahead and count your gauzes and make sure you have your 20, since everything's still sterile right now, while I'm gathering all the rest of this. You have 20 of them there. And 20 is pretty standard. I've seen packs have more, but so I pull this up and over, kind of cover his tummy up this way, and I'll go ahead and clean them up.
And just counting your instruments really quick.
You bet. Make sure everything came off the table. And I'll borrow one of them, you can.
Okay, all instruments were accounted for and gauze also. Okay. My name is Abby James, and in this video I'm going to be demonstrating capping, masking, scrubbing, and gowning for surgery, as well as gloving. So firstly, what I'm going to do is I'm going to go ahead and scrub my hands and my arms. So I'm going to go ahead and remove any bracelets, jewelry that I have on. Okay, so I'm going to go ahead and start running my water. Okay. I have my surgical scrub here. So I'm just checking underneath my fingernails. I'm just making sure that there's no debris underneath them. So I'm going to go ahead and go in and start scrubbing the backs of my hands. And I'm going to go to the side of my hand. I'm going to make my way. Okay. And I'm going to make my way up my arms here. And I'm going to make sure that the water is draining off of my elbows. So with one hand, I am just going to go ahead and dry one hand with my sterile towel here. I'm just going to make my way down my arm. And with the other hand, the same thing. Okay, I'm going to go ahead and head to the surgery room, and I'm going to make sure not to touch anything to maintain sterility. Okay, and for this part, I'm going to go ahead and put the drape on. So I'm just going to go ahead and unfold and place both arms through. And if you can just go ahead and tie that. You want me to rip the tag off? No, that's fine. And I do not yet have my hands through the gown. I already have my sterile gloves open here. Can you please open that one side? So I'm gonna go ahead and grab my sterile glove here. Go ahead and take my other hand and do the same. Okay, and now the gloves are over my sleeves, and I maintain sterility through the whole process. And that is how you scrub, cap, gown, and glove for surgery.